think my story might be a little bit of a different journey that leads us all to the same place as women a lot of times. I was diagnosed with ovarian cancer very unexpectedly, pre-symptomatically, and went through quite a journey in which I had an early hysterectomy, which threw me into surgical menopause, lost my hair, brows, lashes, and chemo. Beauty to a woman is something that goes far beyond the surface and far beyond any elements of vanity. And as it relates to the ability to move forward after cancer, becomes an incredibly important element. And in looking for a physician that really had the highest level of understanding in liposculpture, I first began to separate those who were focused on weight reduction technique and those that were really looking at refinement, at really creating the highest levels of symmetry and bringing a body into complete alignment. And in researching physicians across the United States, Dr. Amron's skills and his artistry created a really fabulous answer to that question.
Well, I met Cameron about 3 months ago when she came in. Actually, she flew in to see me for a consultation for liposculpture surgery, as do many of my patients. And I like patients to come in with a lot of knowledge about my approach. I like them to read my website first and understand specifically how I go about approaching the surgery. In Cameron's case, she impressed me so much with her knowledge of my whole approach to liposculpture surgery. She had researched me extensively over the months before coming in and chose me to do her reconstructive work with liposculpture specifically.
When I came in to meet him, the things that really struck me were that he explained his technique in detail, how carefully he worked with the skin and the types of tools that he had created in order to perfect his technique. But there was a factor that was extremely important to me, and that was really the heart of the surgeon.
She approached me with some concerns that she had, but she really wanted to hear my opinions about what is going to be best to balance her body. And in her case, she has some disproportion, probably from hormonal changes in areas of her body.
When you're working with arms and legs, it used to be that your choices were pretty limited to long surgical incisions. And so Dr. Amron has really perfected techniques to bring things to a level of liposculpture and has introduced some of the latest technology, which would actually correct laxity and introduce symmetry without any sort of long incision.
We're going to approach her anterior thighs today, which is an area that's not very commonly done with liposculpture surgery, but I do a lot of that. Her inner thighs and lower medial thighs and knees, the posterior thighs where she has fullness. Basically, it's contouring her thigh sort of all the way around and creating a three-dimensionally more balanced shape. And I think it's one of the things she appreciates about the way in which I approach liposculpture surgery, not just targeting only specific areas, but looking at a person's body as a whole and achieving a harmony in that person. She also has some changes of cellulite, which we're going to approach in a specific way, and then do some fat transfer to her upper buttock area to give a better, more rounded contour. Just finished surgery on Amron. Everything went beautifully. We did the liposculpture to improve the disproportion, use a laser to smooth out the skin and the cellulite, and then eventually a fat transfer to her buttock, and she's going to get a beautiful result.
His nature was so clearly aligned with my mission. He saw me as a person. He understood what this final step would mean in my journey. It was important to him to connect with me as a patient, as a person, as well as to understand what my interpretation of beauty really was.